Hello and welcome to our special live streaming series, COVID-19 Frontline on CGTN. I'm Zhou Yun. COVID-19 Frontline special online live show for medical experts from China around the world to share their thoughts and experiences in the prevention, control, and clinical treatments of COVID-19. And apart from expert discussions, we also take questions and comments from our followers on various social platforms, such as CGTN app, CGTN official website, and also CGTN official account on Facebook, YouTube, Twitter, and Sina Weibo. So feel free to join us and also to leave your comments, your questions on those platforms with the hashtag of my opinion on COVID-19. We really look forward to your participation. And today we have a very special array of guests from China and Zambia. And in the past over 5 decades, both countries have been a reliable friend as well as a sincere partner to each other, especially during this coronavirus pandemic. Both countries have been making joint efforts to win the battle of COVID-19. So today it is really our great honor to have the guests from both countries. And now it is my great pleasure to introduce to you our guests for today's dialogue. So first of all, we have Ms. Yao Hongjuan, who's the director from Office of Foreign Affairs Commission of the CPC Shanxi Committee. Thank you for joining us. And we also have Mr. Yan Hong, who's the Vice President of Xi'an Jiaotong University. Thank you, sir, for joining us. And also Ms. Lei Yanjun, who's the Deputy Director of Department of International Cooperation and Exchanges from Xi'an Jiaotong University. Thank you so much, madam, for joining us. And also all the medical experts from China today come from the first affiliated hospital of Xi'an Jiaotong University. And they are, first of all, Dr. Shi Bingyin, who's the Dean and Class A Chief Physician from the hospital. Thank you so much, Doctor, for joining us. And also Dr. Li Manxiang, who's the Director and Professor from the Department of Respiratory and Clinical Care Medicine from the hospital. Dr. Liu Zhengwen, Professor from the Department of Infectious Disease from the hospital. Dr. Liu Yi, Professor from the Traditional Chinese Medicine Department from the hospital. And also Dr. Chen Wei, Director of the Department of Laboratory Tests from the hospital. So, and again, all the medical experts from China today come from the first affiliated hospital of Xi'an Jiaotong University. And also we have some distinguished guests from Zambia, and they are, first of all, Permanent Secretary, Dr. Kennedy Malama. Thank you so much, sir, for joining us. And also Mr. Mazaza Nathalie is the counselor from the Embassy of the Republic of Zambia in China. Thank you so much, counselor, for joining us. And also Alex Makupi, Director and Clinical Care and Diagnostic Services from the Ministry of Health in Zambia. And also Daniel, Mr. Daniel Makawa is Assistant Director from the Clinical Care and Diagnostic Services from the Ministry of Health in Zambia. And also Dr. Phineas Tembo, who's a Senior Medical Superintendent, Zambia China Friendship Hospital. And also Dr. Liu Zhao, who's the coordinator from the Belt and Road Joint Research Center of UNZA, and also the person who have been helping us to make the dialogue today happen. Thank you so much, sir, for your support and your help. And also we have Dr. Sende Niklonde, who's the director from the Belt and Road Joint Research Center of the University of Zambia. And last but not least, we also have Mr. Gadian Zulu, who's the Provincial Health Director from the accomplished public health specialist. So thank you so much, everyone, for joining our dialogue today. And now I'd like to open the floor to Mr. Yan Hong, who's the Vice President of Xi'an Jiaotong University, to deliver a few remarks. Please go ahead, sir. Thank you.
Thank you, Masters. Hello, everyone. Good afternoon or good evening. Dr. Malama and all my friends, colleagues from the Zambia side. I'm Professor Hong Yan, Vice President of the Xi'an Jiaotong University. Little bit to tell you, my university is the best one in the western part of China. And my hospitals, it also is a very good hospitals in the western part of China. It is quite happy to have this opportunity. We can take time together to share our experience and talk about how to diagnosis and treatment. And we can learn each other from these long distance meetings. It is very good. And I'd like to tell you in my medical team, the Professor Shi they have very good experience to work in Wuhan, Hubei for 2 months more with his team. They have done a very good job to carefully to offer the health care to the patients. So they have successfully to completed their work in that place and come back to this home place. And also my friends from our first affiliate hospitals, they can share you their work from their common practice in the hospitals. As you know, currently, the COVID-19 epidemic is well controlled currently, but we still can find some few cases from other parts of the China. So this still is a problem. We have to carefully to take care of that. But we have know in the other parts of the world, they have a COVID-19 epidemic outbreak. That's a big problem. So we like to take time to share our experience. We also want to have this good opportunity to learn from you. From the hospitals, pay more attention. We can working together, do some study and research to make the good, excellent performance in the COVID-19 prevention, controlling, special for patients' treatment and diagnosis. So I wish these meetings will be successful. We can learn each other. We have done our good job. So heart with heart, hand in hand, and overcome difficulty together. Thank you very much. Thank you.
Thank you so much, President Yan. As you said, hopefully we can, through this dialogue, we can hand in hand, heart with heart, to gain a better understanding of this pandemic and also to help both countries avoid detours and also better fight this pandemic. And now it is my great honor to introduce to you Ms. Yao Hongjuan, who's the director from the Office of Foreign Affairs Commission of the Shanxi CPC Committee, to give us a few remarks. Please go ahead, Ms. Yao.
Thank you, Zhou Yun, for having me. And first of all, I'd like to take this opportunity to express my sincere thanks to Xi'an Jiaotong University for giving me this opportunity to get to know so many government officials, diplomats, and doctors of the Republic of Zambia on behalf of Shanxi Provincial People's Government Foreign Affairs Office. I am very happy and privileged to be here and to attend this virtual meeting. Ever since the outbreak of the COVID-19 and under the leadership of President Xi Jinping, the Chinese government has adopted the most comprehensive, most stringent, and thorough prevention and control measures. Now, the epidemic in China is mostly under control, and people's lives are back to normal, and our people in Shanxi are back to work, and our students are back to schools. Zambia and China shared traditional friendship dating back to the middle of last century. Both Chinese government and people cherish this special friendship, and we would like to carry it forward. For example, during the outbreak of the COVID-19 in China, we had in Shanxi more than a dozen of Zambian students studying in Shanxi, and we took good care of them over the last 3 months. Now they are safe and sound and happy in Shanxi. Since the COVID-19 outbreak, we watch closely of the situation in Zambia, and we understand the feelings and difficulties of the people in Zambia that are experiencing and suffering And that is why we are here to have this virtual meeting. The world is a village, and we live in the community of shared future for mankind. Only can we put our hands and hearts together, can we get through this together. And this online meeting is a proof of our joint efforts. So lastly, I would like to wish this virtual meeting a great success. And I hope that the friendship between our two countries and our two peoples may last forever. Thank you.
Thank you so much, Ms. Yao, for sending your support and also your good wishes to the people of both countries. And now it is also my great honor to have Councillor Mazaza Nasli from the Embassy of the Republic of Zambia in China to deliver his speech. Thank you so much, Councillor. Please go ahead.
Thank you very much. Good morning, Zambia, and good afternoon, China. Let me recognize the protocols highlighted by the host. My task this afternoon is actually very simple. I'm supposed to call upon the Permanent Secretary to give his opening remarks, but I would be failing in my duties if I don't mention that Her Excellency, the Ambassador of the Republic of Zambia to China, Mrs. Winnie Chivesakunda, actually initiated this interaction. She, however, delegated it to my office because it is more of a technical area. However, she is sending her greetings and she is encouraging both teams, and particularly the team from Zambia, that they should have arrangements with the individual specialists so that this should just be the beginning of a long-term relationship. For now, I would want to call upon the Permanent Secretary to give his opening remarks. Thank you.
Thank you so much, Councillor. And yes, now please welcome Permanent Secretary Dr. Kennedy Malama to give us the opening remark.
Thank you very much. I also ride on the protocols given area by the Director of Ceremonies, and also to appreciate all of you senior colleagues there in China, and also my team here in Zambia, various experts who have joined me. But let me also commend our mission in China for fostering our partnership, and through our Councillor Health there, Dr. Mzaza Ntele, keep it up. Let me start by stressing that the People's Republic of China and the government of the Republic of Zambia have been strategic partners for so many years. Outside the health sector front, we remember the construction of the Tazara rail line, among other major projects which China supported Zambia to do. The memories are still fresh of Zambians and the people from China coming to help us and bring development to our country. As government, we are convinced that our partnership as government of the Republic of Zambia, we are convinced that our partnership will continue growing before, during, and indeed after COVID-19. Let me start by commending China for the magnificent and wonderful and great response you mounted, or you've continued to mount, to fight COVID-19. The global village has been watching China from the time the first case was detected in China in 2019 to date. China has been a shining example on how, as a collective, you can mount an effective response. What we are seeing today from afar in China is a controlled outbreak, and would like to put it on record by commending His Excellency the President of the People's Republic of China and the whole leadership for the success we've seen. As Zambia will also take this opportunity to pay our condolences to all the people in China who have lost their lives from COVID-19. Coming to Zambia, Zambia has mounted a multi-sectoral response to COVID-19. Similarly to China, in Zambia, this response is under the leadership of His Excellency the Republican President, Dr. Edgar Chagwa Lungu, who has been providing strategic leadership on how we can continuously shape the response. Colleagues, today, Zambia's multi-sectoral response is anchored on key pillars, similar to what China was sharing. We are focusing on how we can continuously heighten surveillance, improving our laboratory diagnostics and subtyping, which continues to be a challenge. And I'm sure as you go deeper in the discussion, we would want to learn how Zambia can further scale up the testing platform, because we've realized that testing, as you fight for COVID-19, is a key pillar to success. We are also ramping up in infection prevention and control. We would want to learn how China has performed with respect to preventing infections among healthcare workers. I'll be alluding to a few statistics before I conclude. In Zambia, we've seen that healthcare workers and indeed other frontline workers are at risk of contracting the coronavirus. So we continue investing in infection prevention and control, and it will be good to learn lessons from China. The other key pillar for us is case management. And Zambia has shown already that we are able to do better in case management. And particularly with this kind of platform where virtually we interact with our colleagues from China, we should even be looking for better outcomes. But for now, we are investing in case management through capacity building and other initiatives, coupled with efforts to provide the necessary equipment and consumables. For Zambia, issues of risk communication and community engagement is key, because we've realized that even as we mount a response to COVID-19, we shouldn't leave anyone behind. And we are investing in that, and it will be good once again to learn from China, even before you picked what risk communication interventions you employed, which led to the successes we are seeing. And lastly, the issue of supply chain and trying to stockpile commodities for Zambia remains a challenge. As you are aware, as the numbers continue increasing, we need to ensure that we don't only cut transmission, but also we protect our healthcare workers. So the issue of personal protective equipment, commodities, and consumables for us has remained a challenge, but we continue investing in that. So where are we as a country? Zambia recorded its first case of COVID-19 on the 18th of March this year. You can see it was pretty close to 3 months thereabout, or 2 months and some weeks from the time China recorded its first case. As at yesterday, as a country, we are standing at 441 confirmed COVID-19 cases. We've lost 7 people from COVID-19. Currently, 117 have recovered or discharged, and we have 317 who are active or currently under treatment. So far, what we've seen is that the majority of the people we've confirmed the coronavirus tend to be stable, but it's too early for Zambia. As I alluded to, our first case was 18th March 2020. So we are employing a cautious approach in our fight to COVID-19, while keeping a tab that those who have COVID-19 are prevented from succumbing to death. Colleagues, let me mention that as government, we're excited that Jane Jantong University Hospital and ourselves have an opportunity this morning, for Zambia this morning, for China this afternoon, to compare notes. And it's my expectation that the various experts from Zambia will take advantage of this platform to ask difficult questions, because China, you remain a global model on how you fought COVID-19 to where you are today. It's unbelievable considering your huge population, and when we compare to the confirmed cases and the mortality you recorded. So indeed, we have a lot to learn. As I conclude, just to mention that We hope these virtual meetings are going to catalyze further collaboration and partnership between Zambia and China, even in areas where we are already operating, namely enhancing human resource for health, ensuring commodity security for essential medicines, medical supplies, infrastructure equipment, health security, and would like to commend the China CDC for being magnanimous and a strategic supporter to Zambia in enhancing health security through our National Public Health Institute. We see research as an opportunity for collaboration between China and Zambia. With those remarks, I take this opportunity once again through our Honorable Minister of Health to commend you colleagues in China and also our mission represented by Councillor Health Muzaza there for this wonderful opportunity. And I'm very convinced that both parties will do their best. Very much. Thank you very much, Director of Ceremonies.
Okay, thank you so much, Dr. Malama, for your speeches. And hopefully, as you said, the dialogue today can help Zambia better deal with some of the pressing issues that they have just mentioned, for instance, the protection of the medical workers fighting the front line, and also other issues. And hopefully the dialogue today can help both countries to enhance their bilateral ties to an even higher level. And now, without further ado, I would like to open the dialogue today. And now, first of all, we'd like to have Dr. Shi Bingyin, who's a Dean from the first affiliated hospital to Xi'an Jiao Tong University, because both him and also his team members have either the first-hand information of treating patients with COVID-19, or also they had the frontline experiences in fighting in the hardest hit city of Wuhan in China. So we would like to welcome Dr. Shu to introduce us the management of critically ill patients of COVID-19. Please, Doctor.
From the first affiliated hospital of Xi'an Jiao Tong University. Good afternoon. It's my great honor to be here and share some of our experience in Wuhan. And I'd like to take this chance to give a short introduction on the management of critical ill patients of COVID-19. Why I choose this topic? Because the effective management of seriously ill patients is the core of all clinical treatment. COVID-19 has become a global public health problem. And you see many patients infected in the worldwide, and some of them have deaths. And thanks to government and to take very effective measurements, now in China, and COVID-19 is completely controlled, and about 4,643 patients were died. According to the arrangement of the National Health Commission of the Chinese, we depart to Wuhan on February 4. I led a medical team of 137 members and took over 2 wards for critical ill patients in Renmin Hospital of Wuhan University. At the beginning, works in Wuhan was kind of hard. There were many serious cases in the hospital. Besides, because the inpatient ward was temporarily transferred from a common department to the infectious ward, conditions are relatively poor. short-handed troubled us a lot because the most person was quarantined. So we tried to ensure the quality of our medical care in such poor condition. First is to take close observation on patient's condition, and then to adopt precise adjustment on the treatment, and also to ensure the nursing quality and to give living care of our patients. The last one, which is also of vital importance, is to take holistic care of our patients to elevate their pain and loneliness. To my delight, after our careful work, several days later, vast majority of our patients went out of danger. However, such an improvement shouldn't be limited to our ward. I think about one thing, how to lower the deaths of the hospital. We established a death rate lower group, and my suggestion, the group would discuss all death cases every day, analyze their cause, review the whole treatment process, and finally give our professional advice. The great results were achieved pretty quick. Here we can see the highest death toll was 8 per day before. All group was assembled on February 16. Only 3 days later, there was a 3 days period of zero deaths. And another 6 days later, we saw 0 deaths for about 1 week. It is quite a stable trend during later period, and some cases were caused by other disease like myocardial infarction instead of Here list the 5 characteristics from our patients. The first, most death patients are old patients, especially those patients with chronic disease, that's like diabetes and coronary disease, and so on. Also, these patients stayed out of the hospital for more than 10 days. The interval between hospitalization and tracheal incubation was more than 7 days, and they almost all died within 24 hours of tracheal incubation. According to our discussion, we tend to believe that such a short period of 24 hours is mainly due to too late to do the tracheal incubation. Later on, the interval between tracheal incubation and the patient's death prolonged to 7 days. we think it might be improved by the advanced trachea incubation. Bed patient management may also help. For such patients, the most death cases are results of other reasons, like infection and hemorrhage and so on. Based on above results, I concluded the following advice for the treatment of critical ill patients of COVID-19. First of all, we should prevent patients block the pathway from mild to severe patients. For the second one, we should move key treatment forward. For example, adopt endotracheal incubation earlier. It may support patients' breathing. ECMO is of the same reason. Here I list some other therapeutics for critical patients. Of course, the general treatment of and life supporting not ignored. The most concerned patients should be first the old patients, especially those with diabetes, hypertension, and cardiac disease. The second is the patient with serious pulmonary, and also the patients have the cytokine storm. And finally, I want to show a special patient, the patient in our hospital in Xi'an. The patient is a female and 66 years old. Now you see patients come to the hospital on February 5. And in the February 6, we give the non-invasive ventilation. And 1 day later, give the And on the February 7, give the invasive ventilation, and February 9 to give the ECMO. And just because of the very early treatment, the patients recovered for about 46 ECMO treatment. So this is what I wanted to talk and how to treat the patients with the severe patients of COVID-19. Thank you very much.
Okay, thank you so much, Dr. Shi, for sharing with us your experiences and also your insights on treating patients with severe conditions of COVID-19. And now I would like to give the floor to our guest in Zambia. So now is the Q&A session. So whoever has a question can just feel free to raise them. So yes, please go ahead, Jenna. And before you start talking, please remember to unmute yourself. Does anyone has a question? Please feel free to go ahead. So yes, please go ahead, Dr. Tembo.
Good afternoon, China, and good morning, Zambia.
Mine is about infection prevention and control with regard to the healthcare workers. Lev Mwanawasa University Teaching Hospital is one of those hospitals which is treating or looking after patients who have tested positive. But we have also had some healthcare workers who have become positive in their line of duty. I would like to know the Chinese experience, how you were looking after these healthcare workers in terms of after they've looked after the patients, where were you keeping them? Were they going home, or you had a special place where you were keeping them to reduce the likelihood of infections from the patients to the healthcare workers? That's one. Two, how were you dealing with the medical waste? For example, the PPEs. How did you deal with them so that transmission from the PPEs after they've doffed? They've used the PPEs, now they have removed them, they tie the gowns, the masks, and so on. How did you handle such waste? Thank you very much. I would like some reaction from members of the panel there.
Okay, thank you so much, Dr. Temple. So our experts from China, so who can answer those two questions? So one is about the protection of medical workers at the front line, and the second is about how to deal with the used medical waste, such as those PPEs, including masks.
Okay, my name is Man Xiangli. I'm from Department of Respiratory and Critical Care Medicine. So the first question is how to prevent the infection of healthcare worker. Yes, that is an important issue in our country. I think in the worldwide, because no matter we are doctor or nurses or some other healthcare workers, the first thing in the diagnosis and treatment of COVID-19 patients, the first important thing we need to protect ourselves infection from the patients. So how to do it? I think the several things is very important. First one is we need to get a mask, and sometimes and the particular clothes, and also some glasses or protective glasses or some screen to protect our face, and I think that's very important. And also, once we see the patients left the patients, we need to wash our hands thoroughly. That's very important. The second question is if the healthcare worker is positive for COVID-19, how we deal with this healthcare worker. I think once the doctor and the nurse is diagnosed with COVID-19, we need to count them as a patient. We need to separate the patient, separate the doctor and the nurses in a particular department, like regular patients. We give them some medicine to antivirus, and also we give them the oxygen therapy for severe one, and also we need to separate with regular worker, with regular doctor, regular nurses in case human-to-human transmission. I think for the waste, maybe the first thing is the mask. I think once the mask for 1 day or 2 days, we just and get it and fold it. Sometimes we put it into kind of envelope and then throw it into a particular baggage tank and to save it. And the whole hospital, we collect them and transport to particular place to give a discharge, I think.
Okay, thank you so much, Dr. Li. And also Dr. Tembo, yes, because the second question might be a little bit hard for our Chinese counterpart to answer, because they are doctors who usually, whose major responsibility is treat patients. So we have other logistic departments and other also service departments to take care of the residue and also the waste of the used PPEs. So maybe our doctors can answer the questions which are relevant, more relevant with the treatments of the patients, not with something like the how to deal with the PPEs. Maybe we could have other teams to help that, to answer that. But thank you so much for your question. For other doctors, yes, if you have a question, just feel free to ask them, or you can also raise hand on Zoom. So how about Dr. Zulu? Do you have any question? Or we can turn to. Yes, please go ahead.
Thank you very much. This is Dr. Zulu from Eastern Province. I have some colleagues with me here, the medical superintendent for Chipata Central Hospital. So there is a question that we have posed there. Would want one of the doctors to just elaborate. There are about 3 questions there. Could they elaborate more on the infection prevention measures in the hospital, including patient flow in the hospital? So what was the setup like? And also, what are the specific measures that they employed? We know they've talked about face masks, hand washing. What specific parameters were they considering in order to institute early intubation? And also, what is the specific antiviral medication which showed the greatest benefit to the patients? Thank you very much.
Okay, thank you. So the first question is about the setup of the layout of hospitals, right? Or for reducing the possibility of infection rate for medical workers. Was that the question for the first one?
Yes, please. So how is the layout of the hospital and the flow of patients?
Okay, thank you. So I think we can maybe answer them one by one. So for the first question is, what kind of special arrangement do you have in the hospital in order to better protect either the patients and also the doctors? So in Chinese, it's more like, 比如说咱们的医院有没有一些特别的设置或者一些流程的设置，然后来去降低这样的一个感染率，然后来更好的去保护不管是患者还是我们的医护人员，就大概的一个比如说流程，大概的一个在医院不同楼层啊、不同部门这样的一个安排是什么？ So our doctors from China who can answer that question. Thank you. One second. Okay.
Firstly,
okay, now it's good. Yes, please.
Firstly,
we
will screen all the patients about the temperature and ask about the epidemiological data. And then according to this data, we separated the patient to low-risk patients, and they will go to the route for the general patients. And if the patient has some risk factors, we'll screen for the SARS coronavirus 2 RAA. If the RAA is negative, we can treat the patient as usual. If it is positive, we will isolate the patient and treat them as COVID-19. Thank you.
Okay, thank you so much, Doctor. And what about the second question? The second question is about the prevention measures, right, Dr. Zulu? So some of the parameters that we use here for the prevention measure, not just the mask or cleaning hands. Was that the question? 1 second. Wait,
yes, for the prevention of the infection, to the doctors, we take many measures, like we wear several layers of garments. We wear face masks. We also use goggles. And after the work, we wash the hands roughly. And also for the doctors who may be suspected to contact with suspected patients, they should isolated for a special period of time before they go home. Thank you.
Okay, thank you. And Dr. Zulu, could you please repeat your third question?
So the next question was, what parameters were used to consider patients for intubation?
What about
that was the second question? Yeah.
What parameters were used for patients' incubation?
Yes, please.
For patient incubation? So you mean for the
incubation of the virus, right?
For early intubation, I think in the presentation they told us that some patients were intubated, and also gave us a presentation of some who were dying within 24 hours after intubation. So I wanted to find out what was the criteria for intubating? What were they looking at?
So for the suspected patient in the incubation period, we isolated them for more than 2 weeks, and then we should detect the SARS coronavirus 2 RNA. If it is negative for 2 times and 1 day apart, we can think the patient is not, the individual is not infected with the virus. It is clear?
Okay, so my question was on putting up the endotracheal tube. So to intubate the patients, I just wanted to know, how are you deciding this one requires intubation, this one does not require? Knowing that you also mentioned to us that you seem to have deaths occurring after intubation. Not so incubation, intubation.
So you mean the patients who have no symptoms?
You mean the incubation of the virus, or is what? Yes, other doctors, please. Yes.
Yeah, I would like to make some supplementation. Yes.
Yes, please, doctor.
Yes, I would like to do some supplementation. So usually for the severe one, we do some intubation, like because even though we give them the oxygen therapy, regular oxygen therapy, the oxygen they still lack of oxygen. They break the bracelets. So we need to do some invasive and non-invasive ventilation. Usually, first we choose the non-invasive ventilation, like we use a mask to cover his nose, patient's nose and the mouth, and we do some. We try to increase the oxygen concentration and also give a pressure support to try to force oxygen into the lung. If it doesn't work, then we need to do intubation ventilation and use some. Of course, there are some complications for this kind of procedure, like infection and also bleeding and something. This is only for severe one. But for moderate one and slightly one, we don't need to do it. I'm done.
Okay, thank you so much, Doctor, and also Dr. Zulu. And I saw our experts from the Eastern Provincial Health Office has several questions. Yes, please, doctors, please feel free to ask them.
Thank you so much. And thank you for that answer, the clarification on intubation. One of the strategies that were instituted in order to improve survival was to, as was mentioned in the presentation, was to intubate the patients early. So what we wanted was to understand what were the parameters that were used to identify which patients should be intubated early and which ones may not be intubated early. But the first question we wanted to find out was that what were the specific antiviral drugs which seem to have showed the greatest benefit in terms of patient survival from the presentation? Thank you.
Okay, thank you. Another one is also about the antivirus drug. So yes.
About the antiviral drugs, in China we tried many drugs like the lopinavir, ritonavir, interferon alpha, ribavirin, and hydroxychloroquine. There are many, but until now, some drugs may seem to be effective for the treatment of COVID-19. One, I think, should be the lopinavir, ritonavir, although there is a clinical trial in China showing that these drugs are not very effective. But there are some questions about the trial because most of the patients use the drugs too late. If the patient uses the drugs earlier, it should be effective. Now, recently, there is a trial in Hong Kong. They use the lopinavir, ritonavir, combined with interferon 1 beta and ribavirin. The results showing that this combination treatment can significantly reduce the duration of the disease and alleviate the symptoms of the patient. And remarkably, it can also increase the negativity of the SARS coronavirus in the pharyngeal swabs. And there are also a drug like remdesivir. There is also a trial in China, but because of the shortage of the patients in later stage, this trial stopped earlier than expected. So in the limited number of patients, the result seems no specific effect. But in the United States, the compassionate use showing that this drug, remdesivir, should be effective for the treatment of COVID-19. Thank you.
So for the intubation, I still want to say two things. So because this is an acute virus infection, usually in the lung, the pathological characteristic is like ARDS, acute respiratory stress. So for this kind of ARDS, we need to do some oxygen therapy. The first one is, like our dean said, non-invasive ventilation. If it doesn't work for it cannot improve the oxygen in the blood. So we need to quickly and early and possible and soon to transmit to the invasive ventilation like intubation. And after we get the invasive ventilation for like a couple of hours, we need to assess the patient's condition, whether it is improved or getting worse and worse. If it improved, it's okay. We can maintain the invasive ventilation is fine. But if it doesn't work or getting worse, we need to transfer to the ECMO and so on possible. In this case, we can get the success rate to get the patient alive. Otherwise, the patient will die soon.
Okay, thank you so much, doctors. Yes, I think we have two participants raising a hand. So yes, the officials from the Ministry of Health conference. Yes, from the Ministry of Health. Yes, please go ahead, sir. 1 second, we need to.
Afternoon, China.
Yes, now we can hear you. Yes, yes, sir.
Richard. So I wanted to find out how often they were using antibiotics to treat these critically ill patients, in particular the use of azithromycin. Thank you.
Because when you said your first part of the question, it was still muted, so we didn't get to hear the first part. So could you please, if you don't mind, repeat your question again? Thank you, appreciate it.
Okay. That's okay. I wanted to find out how often they were using antibiotics to treat the critically ill patients, particularly the use of azithromycin. Thank you.
Okay, thank you, sir.
So about the antibiotics, we usually do not use the antibiotics. But if the patient has a secondary infection from the bacteria, we can choose the antibiotics. Maybe, as you know, there are some reports using azithromycin to treat the COVID-19. For this medicine, it can be used for the infection of bacteria, but some study shows that azithromycin also has antiviral activity. So I think if it is used, maybe it should also be used for the treatment of COVID-19 with other drugs, because there are also reports they using the hydroxychloroquine combined with azithromycin. It says this treatment is effective, but the finding need to be confirmed in other trials. Thank you.
Okay, thank you. And we also have Dr. Elioid Kafumukaki raise a question. So yes, sir.
Thank you very much for the presentation. My question is on the pathology, mentioned on the pathology, of course, that the signs of the pathological reports were more of the disseminated intravascular coagulation. Did you try using or transfuse your patients to see if they improved? Because if it was just giving oxygen, and we know that giving oxygen where the issue is just purely that the issue is in the blood absorption of oxygen, why not transfusion? Did you try transfusing your patients?
You mean, do we transfuse blood to the patients?
Yes.
Yes, we used the plasma from the convalescent patients to treat several patients. The results showed that the convalescent plasma is effective for severe patients. Thank you.
Okay.
Okay, we're seeing a doctor from UTH. Raise your hands. Yes, doctor, you can just feel free to ask the question. We saw AIDC UTH.
Good afternoon, good morning, Zambia. This is Sombo Foloshi from UTH. We wanted to find out, was there a role for low molecular weight heparin for these patients, especially in the context of the hypercoagulable state?
Did our Chinese experts get the question? Do you mind repeating it?
Did they use low molecular weight heparin? Because we've seen some studies that have showed that it's beneficial, and we have used it on some of our patients. heparin, Taxane, an anticoagulant.
So you mean you use the anti-malarial drug for the treatment of patients with COVID-19? No?
A blood thinner, anticoagulant, heparin.
Yes, we use the anticoagulant for the treatment of the patient because the study find that the patients with COVID-19 has a coagulopathy in the patients. So we use.
Yes, because the patient for the severe one, they all for the whole day they lie on the bed and because they don't sit or work around the bed. They all days lie on the bed. So it is easy to form the coagulation in his vein or in her vein, and also sometimes for the invasive ventilation or invasive treatment like for ECMO and also for some CRT, we need it's easy to form a coagulation in his blood or in his vessel or her vessel. So we need to give some heparin, low molecular heparin to treat or to prevent the formation of the DVT.
Mm-hmm. So what about other doctors? So Dr. Joseph Mosowaya, do you have any question?
Thank you. I think I wanted to find out partially some of my concerns have been answered, but the immunity after COVID infection. I was asking this looking at the way your ICU has been set up, as most of the patients are not critical, not very sick. Maybe it's because of the numbers. Most of our patients are either asymptomatic or very, very mild presentation. So if you put them together, there are high chances of reinfection, which can lead to prolonged admission. So I wanted to find out if you did any studies that indicate acquisition of immunity after exposure. And also, second question is, how often were you disinfecting where you had kept the patients in isolation, whether in a shared isolation ward or if they were also put in separate rooms? Thank you.
So we put the patients with different severity of the disease in different rooms, like the critically ill patients in the ICU, but the patients with mild disease in the general ward. So. 就是我们是用得到 ICU， 轻的还是普通病房。So, yes, if the patients are confirmed cases, they can be live in the same room. If before the confirmation of the diagnosis, the patients are isolated in different rooms to prevent the cross infection.
And also, if they are mild symptoms, we put them in the temporary hospitals, right? For those
yes.
Asymptomatic or very mild symptom patients.
Yes, we also put the patients with mild disease in hospital because they can serve as a source of infection. If we let the patient with mild disease go home, they can transmit the virus to the family members. As you know, this disease has a very prominent characteristic of family clustering. So we isolated all the patients, including severe patients and mild patients in the hospital. Thank you.
Okay, thank you so much, Doctor. Dr. Michael, do you have any question?
Yes, thank you. I'd like to know if you had any patients who required to undergo surgical procedures, and if you did, were there any precautions, extra precautions you were taking for those?
So in our hospital, we did not have patients to do the surgery. But in China, there are some surgery in some other hospitals. For the patients who need an operation, the doctors should use very strict isolation measures and when they perform the operation, I think.
Thank you.
Thank you.
Okay, I think we have more questions from the Eastern Provincial Health Office. Yes, please go ahead, sir. One second, you're still muted. Okay, now it's good.
Thank you so much. Good afternoon once again. I wanted to find out if there's a particular role for anti-inflammatory drugs, seeing that there's quite a huge inflammatory response in these patients. And if so, which ones appear to be very beneficial in your experience? Thank you.
It's the anti-inflammatory drugs, right?
That's a huge man. So you for
您需要再说一遍，他说的可能是抗炎药，因为刚刚您的信号有点断 ，so yeah, please repeat what you just said to him.
So for the anti-inflammatory drugs, we did not routinely use these drugs, but for some severe patients, there are something like the cytokine storm. In China, we use the anti-interleukin-6 antibodies to suppress the cytokine storm for the treatment of the severe patients. Thank you.
And also, for some severe one, usually we use corticosteroids to treat, to suppress the severe inflammation, like Professor Liu just mentioned, cytokine storm. But it's for short time, like 3 to 5 days, and also the appropriate dose, like 40 to 80 milligram of the prednisone, like.
Okay, thank you so much. So for other doctors and other officials, do you have any question? Please just feel free to go ahead, because we might have time for only a few final questions. Counselor, do you have any question?
No, I do not have any questions. My role was actually to facilitate.
Yes. Okay, thank you. So for other doctors, yes, if you have any final question, please feel free to go ahead. And also just now, okay, I think the adult infectious disease, is it still there?
Yes. Tanya,
yes, you had a question, right? Yes, now we can see you. Yes.
Okay, yeah, so I wanted to find out on the antivirals that were used and which ones proved to be more effective in their experience. Thank you.
So in our experience, we tried many antiviral drugs, like just as I said before. But from the current data, it seems to me that remdesivir appears to be effective, and also the lopinavir, ritonavir should be effective, especially when these drugs are combined with other drugs like Abidol or interferon beta or ribavirin. It should be effective. But for the most, they used drug like chloroquine or hydroxychloroquine. At the initial clinical trial in the mild patients, these drugs seems to be effective, but in the later clinical trial showing that chloroquine, especially hydroxychloroquine, seems not to be effective for the treatment of the patient. Also, there are some side effects like the QT interval prolongation are very common for the patient when they use the hydroxychloroquine. So there are also an observation in the United States showing that the use of chloroquine seemed to be have more side effects. The mortality rate is higher than the control patients. So we need to wait for the randomized clinical trial about the use of chloroquine or hydroxychloroquine in the treatment of COVID-19. Thank you.
Okay, thank you so much, Dr. Leo. And also Dr. Tembo. Yes, please.
Thank you. Thank you very much. I didn't get it very clearly about the doctors, the nurses, the cleaners. After they've treated the patients, were they going home to their home where they've got family, or they were kept somewhere else? I really need to find out about this. Thank you.
You mean for those who are treating patients on the front line, but they have not been affected, right?
Yes.
Just like what are their daily routines like? Okay.
So for the doctors, nurses, and the cleaners who treat or contact with the patients, we should keep them in another place. They should not go home. But after a specific period of time, they should be quarantined for more than 2 weeks. After these 2 weeks, if they are okay, then they can go home. So, thank you.
Okay, and Dr. Zulu, please.
Thank you very much, and thank you for sharing your experiences. From your experience in managing patients in China, what are the 3 take-home points you would say, well, colleagues in Zambia, as you manage patients or as you respond to this COVID, these are the 3 critical areas you should look into? What are those 3 critical take-home points you would share with us?
Wow, it's a tough question though. Maybe they have like a million, but only 3. So, but yeah, the challenge is now on the Chinese expert side. So, do you have any 3 takeaway, like most important takeaways that you think can work as a kind of reference for the doctors and also the experts there in Zambia? What would be the 3 top suggestions that you would give to them, which are most effective ones?
Okay, thank you very much. I think first, and to do the personal and protection, and even for the popular generation, and also for the doctors and nurses. And the second is to seriously to treat the mild patients, especially patients and old patients, and also the patients who have the diabetes and the coronary hypertension and coronary disease, because these patients will become the very severe patients and even died. And finally, I think should be to move some key treatment forward. For example, the tracheal incubation and also ECMO. If needed, immediately give the treatment. Thank you.
Okay, thank you so much, Dr. Shi. So any other doctors, do you have anything to add on that? And also, I noticed there's a doctor who specially focused on the traditional Chinese medicine. And as also we know, in the treatments at the front line of Wuhan, actually, some of the treatments are more like a combination of Western medicine and also traditional Chinese medicine. And maybe finally we can have doctor to share with us a little bit on the role of the traditional Chinese medicine that have been played in this in treating the patients with COVID-19. So can we have Professor Liu Yi to introduce to us a little bit about the role of traditional Chinese medicine, maybe very briefly? Thank you.
Okay, thank you for your question. And since in our hospital we don't have enough cases, so we don't have the clinical trials in our hospital. But actually, we based on the Chinese Health Commission and in Chinese administration of TCM guideline, we also use the specific Chinese pattern of medicine. For example, 莲花清瘟 capsule on all of the confirmed cases in our hospital. In other words, all of the cases in our hospital, we give them TCM treatment. And but in Wuhan, in Hubei, and there are specific TCM wards were set up. And also there are established and designed hospital were carried out. And there many some clinical trials have been carried out. And as according to the published papers, we can find, for example, the first proved clinical trials that is to use herbs that is called 化氏白术 formula. And according to the published paper, it was said they used this cases they used randomized case control study. This study was on 452 patients, and in these cases, and they in their results, they find that not only the symptoms was elevated, but also the nucleic acid turning negative rate have been significantly decreased. And also some other case control study was reported. For example, they used 清肺排毒 decoction, and this study was designed, was used in 102 cases of mild cases. And in these cases, not only the symptoms, but also the CT images was also improved. And that's a short review about our TCM research in China. Yes, thank you.
Okay, thank you so much, Dr. Liu. And before we wrap up, just I wonder any the guests from our Zambia site, do you have any more to ask, or do you have more to say? If not, we're just going to conclude today's discussion. 施院长，您那边在我们收尾之前，您还有什么其他要补充的吗？ So before we wrap up, do you have anything to say or to add on that?
好，我最后拿中文来说一下，因为我英文不是太好。非常高兴今天有机会呢，能够和赞比亚的我们同行呢做了一个很好的交流。因为我们中国呢已经这个得到有效控制，那么我们呢也是在武汉，在我们医院都有很好的经验，所以呢今天呢非常高兴和我们赞比亚的同道我们做一个交流。那么也希望呢这个我们今后如果有任何的需要，那么我们将一起来交流。那么非常谢谢这个主持人今天下午呢做得很好的主持，谢谢。
Okay, thank you so much. So I'll just translate hopefully I can translate some parts of your speech, hopefully the whole part, because now China has made some progress in fighting, containing the coronavirus. So today it is really my great honor, my great pleasure to communicate with the experts from Zambia about some of the experience that we've had in the front line of Wuhan, which was the hardest hit city there in China. So if you have more questions, if you have more requests, so feel free to interact with us. We're more than glad to help. So thank you so much. And also, yes, Counselor, please.
Yeah, before you conclude, I just wanted to mention to say the initiative was meant to benefit the two teams, both Zambia and China, and we would want the individual specialists to maintain contacts with the Chinese counterpart. And then we have a request to make. I was informed that in September, Xi'an will be hosting a China Southern Africa Medical Expo. So if the communication is sent well in advance, so that we could also get scientific papers from Zambia to be presented during that forum. Thank you.
Okay, thank you so much, Counselor. And with that, we're going to wrap up today's discussion. And just as so many experts and senior officials said, that this is a global challenge and also only can be tackled with solidarity as well as international cooperation. And hopefully the information and also the information experience shared and consensus reached today can help the people and also medical workers of both countries to better fight this pandemic and also help to make a difference in many countries. So thank you again for our experts and also our senior officials for your time and your contribution. A big thank you to our followers for your submission and your time. We have more to come in the following days. So thank you and bye for now.